Democratic Congressman Elijah Cummings, here now to tell me what that very important thing is. What is it?
How you doing, Neil?
Good, Congressman. Thank you.
We've got to have a public option in this bill, Neil. And to be frank with you, I'm pretty sure we're going to get it, in spite of what some naysayers may be saying.
Well, you'll get it in the House, right? The Senate's the dicey part.
Yeah.
Then what?
I think it is dicey in the Senate, but you got to keep in mind, Neil. Schumer was telling me that he sees them, Senator Schumer,
right,
having at least 53, 54 votes at least for the public option, and even those who may be against it, they're not vehemently against it, and they're looking for some room to help out. And so I think that if we come out of the House, which we will, under the leadership of Speaker Pelosi, with a strong, robust public option, I think, and we come up with something approaching a public option in the Senate bill, I think in conference we'll be able to get what the President has asked for and what I've been asking for.
You know, Congressman, I apologize, sir. I've talked to a lot of your conservative Blue Dog colleagues. I guess there are 52 of them. And I guess more than half, at last count, are not a fan of a plan that includes a public option and would vote no. So that means getting the votes for just a simple majority in the House suddenly are looking like not a sure thing. How would you handicap it?
No, I think we're going to, I have absolutely no doubt that we're going to get the public option in the House. And talking to my friends in the Progressive Caucus and others, I think we're in good shape there. And again, I think Speaker Pelosi has done an outstanding job. And I think
has
that
she
some
really?
of the people,
because they're ticked off. When I talked to them, they weren't happy that the way they were kind of treated, shunted aside. Now, I know all this is a negotiating tactic. You don't want to give everything away before you go to conference with the Senate.
Sure.
These were not happy campers, Elijah.
Well, I think that I got to tell you, I think Nancy Pelosi has done a great job. She's got to balance the Blue Dogs with the progressives,
right,
and that's not an easy task. But let me just say this. I really believe that the public is coming around. Even the folks that watch you, Neil, I think some of them are beginning to say, wait a minute, we need something that's going to control the cost.
What do you mean, what do you mean, even the folks who watch me? I'll let that slide. But let me ask you this, Congressman. That was a very good one, but I wouldn't let that go unaddressed. Let me ask you about this so-called trigger that they're considering in the Senate. You've heard it before. I don't want to bore either you or our audience that you'll get the public option if the private savings aren't realized on the part of the health insurance companies. So if you build in this so-called trigger, you're off to the public option races. What do you make of it?
Well, I think the trigger is a possibility, and I mean, if we come out of the Senate with a trigger, I think that is not what I want, but I think it's a good step in the right direction.
Would you vote for that? Then let me ask you this: if that's what it came down to, get your public option, but via maybe something only like a trigger, but it isn't built into the legislation itself.
I don't see that as being enough, Neil, but I do see it if the Senate comes out with a trigger or comes up with the, say, the Cantwell amendment, which would basically make provisions so that the negotiations could go forth in states to lower costs of insurance. Something like that would come out of the Senate. Then we come out with a robust public option from the House. I think that we can, in the end, come out with a bill that has the public option, and I just believe that. I just think that the American public is getting there. They want something that's going to control the cost and provide them with choice. And I think now, you know, the hardest hitting that was done was during August, and now the numbers are beginning to slide in the opposite direction. That is, for a public option. Is it a slow movement upward? Yeah. I think people are beginning
I love you
to
to death, Congressman. I don't know what numbers you're reading. You must be reading a CNN poll. I don't know what it is.
Yeah, well, 65%. 65%.
Well, let me ask you this finally. Just your opinion. If you were President of the United States, Congressman, and you were meeting with doctors at the White House, as this president did yesterday, would you provide, white hospital coats for them to wear so that they looked like doctors?
Yeah.
Just curious.
You got me that time.
I'm just curious.
You got me that time. No, it wouldn't matter. I have a tremendous amount of respect for them, whether they have white coats, black coats, or purple coats. The fact is they play a very important role. I want to see them paid, and I want to see them take care of my constituents and people all over this country who need them. They're very special people, so they can wear a white coat, or a black coat, or a purple coat. I don't care.
Yeah, the purple one would have certainly gotten some raised eyebrows. But Elijah Cummings, always great having you on. Thank you again.
Yes, my pleasure. My pleasure.
All right, Elijah Cummings. So, why do you think this